I came to LBJ because I wanted to work at a community hospital that was also a teaching hospital. One of the things I really enjoy about working in the EC is the fast-paced environment, being able to take care of medically critical trauma patients and also patients who don't have consistent access to healthcare. Hi, my name is Shannon Stevens, and I am a clinical resource nurse at the LBJ Emergency Room. I started out my nursing career in a rural hospital. I worked in a rural hospital for about 3 years. I had built a base of skills as an ER nurse and wanted to work at a bigger hospital, wanted to work at a teaching hospital. So that's what brought me to Harris Health's LBJ Hospital. I have been here for 18 years. I love it. I love it being here every day. I learn something every day. And what I enjoy about working in a teaching hospital is the collaboration between nursing and providers. You get to see these new residents come out. You start building relationships and building trust and building collaboration. And at the end of that, you get to see the progression of the education that the resident learned along the way. One of the biggest takeaways for me for coming to a teaching facility was as the physician was going through their progression, I also learned a lot about collaboration, how to take care of the patients, critical thinking, about escalation of my concerns. I have built tremendous relationships with the staff along the years. I have seen people come in, go up the clinical ladder, move into other areas. We've had nurses who come in and go to CRNA school. We've had nurses who come in and become nurse practitioners. We have nurses who come in and go to medical school and come back and be our physicians here at this hospital. One of the reasons I've been at Harris Health for so long is the staff and the patients. I really love working with the staff we have, not just in nursing, but in all areas of the hospital. It's like working with my family. And the patients, a lot of them have a lack of health insurance or any funding. It is almost like you're not able to be seen that day. Here, we take care of everyone that comes to the door, regardless. Being able to take care of everyone, it helps to close the gap of social determinants of health. When we see patients in this emergency room or in this hospital system, it's not based on their ability to pay for their services. It's based on we want to get the patient better. And it's a big need in this side of our community because there are no other hospitals like us. There are no other hospitals in this area. That's why it was one of the biggest reasons that we're building the new hospital next door. Typical patient population for us is major and minor traumas, major and minor medical patients, patients that come here who can't get their dialysis through a dialysis center. We provide that here in the emergency room. We see all ages of patients, from geriatric patients down to neonates. To be a successful nurse in the emergency room, you need real good critical thinking skills, really good communication skills. You need to be able to discern very important information on layman terms so your patient can understand it. A lot of times your patient is going to be bombarded, since we're a teaching facility, with an attending physician, a resident, a medical student. They need someone who can take that information and condense it down and give it to them where they can understand it better. Some tips and advice for a nurse who'd like to come to work at Harris Health LBJ EC is be ready for a very fast-paced environment. Being bilingual is a plus. Being able to work in all areas is a plus. Being able to triage patients is a plus. And being open to learning in our system is a plus. So if you're watching this and you would like to come to work at Harris Health, I 100% recommend it.